So, Dr. Cruz, in typical GI focused fashion,
Yes.
I ask you, what is a tortuous colon?
I would say in the simplest definition, it's basically a twisty colon.
Twisty colon. So, you do have patients when you're doing a colonoscopy, they have a tortuous colon.
Yes, absolutely.
And I'm going to assume that those procedures are a little bit more difficult.
So they can be a little more challenging. I mean, that's when I'm having a little bit of a difficult time because it's so twisty. Those are the ones where I will then tell the patient afterwards, so just want you to know your colon is a little tortuous. And they're like, what? And so yes, those can be a little challenging, mainly because they're twisty.
And the husband and wife are there going, yes, they have a tortuous colon. That matches their personality. And
Yeah, no.
so I know you have techs in the room with you and nurses and anesthesiologists and all that. So talk about when you have a tortuous colon that you're dealing with, what do you ask them to do to help you through that procedure?
It's a great question. So sometimes if I do run into a colon that's a little twisty and I start really realizing that early on when I put the camera in, sometimes the scope itself, because it's a long tube, will start to loop up a little bit. And I know that that's hard to understand, like what that means. But basically what happens when it's looping up, it's not going anywhere. Yeah, I'm pushing and the scope is just looping up on itself like a hose, like a water hose, but it's not going anywhere. And so sometimes I'll have the endoscopy tech that's working with me, apply a little bit of pressure on the patient's abdomen just to kind of help prevent the camera from looping on itself and so that we can keep it straight as I'm maneuvering through the turns.
Because the idea is we need to get the colonoscope all the way to the end of the colon.
Exactly.
If it keeps looping on itself, you're not progressing.
You're not going anywhere. You're just kind of staying there. So a lot of times they will help me with the pressure that they use, and the tech knows exactly what they need to do. And usually, I'm guiding them and telling them. But if you have a tech that is very seasoned, which most of the techs I work with are very seasoned in what they do, and they know what they need to do. So they will help me, and then I'm able to navigate and push the camera where it's actually moving, and then just kind of navigate it gently through the turns in that colon.
And I know that some GI docs have different ways of doing procedures.